Hi, my name is Denis Thompson. I'm the CEO of ARPWave and the developer and creator of neurotherapy and neuro recovery. Neurotherapy is a patented therapy which addresses the neurological origin for the symptoms that you're feeling today. Until you walked in the door today, every doctor, every therapist, every medical professional that you've met with who are extremely skilled at what they do have worked on where you feel the pain, not where the pain is coming from. Today, we're going to look at the neurological origin of the signal which is causing you the pain. To do that, the first thing we have to do is determine, is your brain sending a fast enough signal to your muscles to where the muscles act as a shock absorber? If not, the shock is going to go into the area that you're feeling pain or restricted motion in. To do this, we have a very simple test that we've created. We call it a neuro efficiency test, and the overwhelming number of you will fail the test. So all we're going to have you do is lay down on your back and think of my finger as your leg, and we're going to have you raise your leg up like this. We're going to put very light resistance on your leg to see if you can stabilize and make sure that it doesn't do this. This has absolutely nothing to do with strength. What it has to do with is your muscles are your outward expression of your nervous system. And if you cannot resist this simple test, we know there's miscommunication going on, and that in fact is the reason you have the pain and where you have your pain. So once we've done that test and you pass or you fail, we go to the next step. So if you did fail, we now need to reset your nervous system. Have you ever had a computer that went blue screen on you and just crashed? Well, what do you have to do? You have to turn it off, and then you have to reboot it. In some cases, you have to reset it back to its original settings, and sometimes you lose some data and sometimes you won't. So what we are going to need to do is reset your nervous system to the very first neurological pattern you ever learned how to do, which is how to crawl. And crawling is the first neuro pattern where the left side of the brain controls the right side of the body, the right side controls the left side. So once we've reset your nervous system, the next step is to identify where is the signal coming from that's causing you to feel the way you do. Now, as I said, before you walked in the door today, every doctor who's extremely skilled has at their disposal an MRI, X-ray, ultrasound, CAT scan. All of those diagnostic tests tell us all the same thing: where the problem ended and the severity of the problem. What we're going to do today is we're going to find out where the signal is coming from that's causing the problem. A gigantic difference. And this, since it is patented, is the only way that this can ever be accomplished. So once we identify where the signals are coming from, we now then need to change that signal using our proprietary technology, and we need to break you of your movement patterns which normally bother you. So one of the very first questions our therapist is going to ask you is, what movement normally bothers you the most? Whatever that movement is, we're going to have you do that movement in therapy while being stimulated, where the muscle is being told to work appropriately, not in the manner in which it's been working for quite some time. Now think of it this way: when you walked in today, your muscles were in a state of protection. So kind of look at my hand here, and when a muscle is in protection, it shortens, so it's like a fist balled up. And what we're going to do today is take this muscle from this position and allow it to lengthen. When we do that, your movement pattern is going to change without pain. So when you're done with this 15 to 18 minute session that you're about ready to go through, you're going to see a dramatic change in the way you feel. And a lot of people think they're cured. They're not. It has nothing to do with being cured. All I've done is disrupted that pattern. That pattern is going to go back to its normal pattern probably 45 minutes from now. The reason you absolutely 100% need to go through this therapy, if this therapy has helped you feel better and able to move more freely, is because every day you go through a session, we're training your body to keep this position longer. And the longer you're in that position, the better you're going to feel. So today could be 45 minutes, tomorrow an hour, the next day 2 hours, the next day 3 hours, and it's a progressive process. And what we're doing is creating a new neural pattern. And there is no other therapy on the face of this planet which can accomplish this goal. And again, your doctor has offered this session to you, and your doctor has been selected out of a very, very large pool of doctors to be our provider of this service. So thank you very much for the opportunity to change your quality of life and to allow you to move freely without pain.